The government of Prince Edward Island undertook an exercise of prioritization of the needs of the Acadian and Francophone community, and that was in the context of the renewal of the French Language Services Act. It was recommended to have an overhaul, and it was done building on the existing legislative framework. The new French Language Services Act was proclaimed in December 2013, and it established clear obligations with the provision of services in French by government institutions. It also allowed the alignment of the priority needs of the community and the capacity of government to deliver those services. It also ensured continued consultation with the Acadian and Francophone community. And talking about consultation, it was one of the key parts of the making in that process. So the Acadian and Francophone Affairs Secretariat had a lead role in the renewal of the French Language Services Act, and some of the methods that were used included internal information gathering, evaluation of the current frame. It also included surveys with the community, as well as partnership with information sessions that were held with the Acadian and Francophone Community Advisory Committee, and a working group that was created with the Société Saint-Thomas d'Aquin, SSTA, which is the sports group for the Acadian and Francophone community in PEI. So all that really enabled government to identify and determine the priority needs that the community, through surveys, had an ability to rank the highest priority. Many priorities came about, but I think one of the main ones that I want to talk about today is really the health priorities that came out, and it really focused on the communication and access to information in French. And it was determined not just for a matter of quality of services, but also for security to the patient. And if we talk about that, it's to show the impact that it had in the delivery of services. There was a strong link identified to show that the recruitment and the retention of bilingual workers in the health sector was quite difficult and challenging. And efforts have been put in that when we talk about the strategies developed by Health PEI, the efforts by French Health Network. It's really a collaborative approach and inclusiveness that enabled the province of PEI to work together and have those solutions found to identify not only internally the capacity, because when we talk about government capacity, it's strongly linked to the number of employees that are able to speak the language. So we have regular reports now for our bilingual workforce, and whether they are in designated or not in positions. So it's a huge task, and it's recognized, but the efforts are continuing, and we're really hoping to have more positive results in the future through the efforts that are done.